My name is Avery Dessel,
And I'm Kelly Peterson.
and we're going to present on the differences in culture and the views of death in El Salvador versus the United States.
Our research question is, how do views of health based on palliative care, cancer, and death differ in El Salvador and in Latino culture than in the United States?
In El Salvador, cancer is the second leading cause of death among the population. Stomach cancer is by far the most common cancer, which is followed by liver, colorectal, prostate, cervix, lung, and leukemia. The Cancer Registry and Plan was just instituted in 2011 to keep track of cancer rates and to institute a plan to make sure that cancer can be reduced. And research on pediatric cancer in El Salvador is very scarce, so it's hard to plan for childhood cancer and palliative care.
In El Salvador, there are 3 levels of care in healthcare. They're all funded by the government. Vaccines are funded and healthcare visits are funded. And it ranges from home visits, clinics, hospitals, to palliative care. Vaccines and breastfeeding are also mandatory.
Hi, I'm Kelly and I'm here with Monica, a dietitian in El Salvador, and she's going to tell us a little bit of the way of life here and the healthcare system.
Can you explain what you do?
My job is to be not only the dietitian in my clinic, I'm more like the one who's in charge about a lot of projects that we are trying to make with the people. About some of the projects are to handle the whole process of the breast milk here in El Salvador. This is not something new that we are trying to implement in the health system. We have a room where we can make the collection of the milk, and we provide this milk to the children. This isn't something that you have to do. If you're a mom, you do it with your heart because you want, and we cannot pay you for that because we have a law here, and that law does not give us the permission to pay you. So I'm the one who's in charge of that area, and also I'm in charge about the different clubs that we are handled about chronic diseases like hypertension and diabetes, fat problems on blood, also with obesity. That's a new problem that our people here carry daily, and desnutrition, mostly in children.
Can you tell us about how healthcare is here versus the United States? Is it easier to access healthcare here because it's free for most people or not?
It is free. If you're working, you don't have an insurance, but you can go to the public clinics that we have. The government Are you still recording?
Yeah.
It's okay, we'll cut this out.
Okay, so start. It's free, but
Trini can come. Next one, in public health system, we have another third level hospital. It will be like who's in charge about the whole psychiatric area, and after this we can treat you in some other hospitals, but they're going to be close to your house. So if you're very delicate, they can treat you close. Also, the first level of attention they have been split in 2. So we have the Unidad de Salud, that is like the regular clinic, and then we have ECOS. ECOS are the groups that they belong to the first level of attention, and they are only in rural areas. So if the people there, the person can come to the clinic, they have to go. In which cases, for example, when they're having a pregnant lady or a just newborn baby, or a kid without any vaccine, that's very serious here. So the doctor and the echos at echos, it has to be in charge of all that area. They only count with 2 persons in charge, around 500 people promedium. And the paper of the nurse in healthcare attention is very important because they are the ones who organize everything, not only the doctor here. And for example, my paper as a nutritionist is to support the nurse, support the doctor, help them every time as it is possible for me. Everything is for free with the government. Everything is free. You can get your your pills, your
Vaccines.
yes, everything for free. I mean, we have a lot of protection here, so no one can charge you, not even a penny. You cannot pay. If somebody is charging you for anything, any service, they can go to jail.
Okay.
Yes.
Can you talk about palliative care in El Salvador?
Yes, we have an hospital named Divina Providencia. It is the only one in the entire Central America that it is for palliative care. Mostly it attends people with cancer, terminal cancer. It isn't public, but it isn't private. This place receives help from people outside of El Salvador and some organizations that they help to hold all the place. And this one is the only one that use the drugs for the pain, that like the most strong drugs for the pain. And they receive people from from the 12 years old to 100, a million years, doesn't matter. And mostly of the cases they die, and when they want to go home, they send you home. They can leave you go home, and then you can die at home.
And what about children with like cancer or children who are dying? Where do they go?
Okay, about the children with cancer, we have an institution only for cancer. When the Benjamin Hospital, that it is the only pediatric hospital in Central America, can treat you anymore, they send you to the cancer institution. But if they cannot treat you anymore, they send you to the Divina Providencia. Yes, and it's like the same from the 12 years.
And how do you get sent there? Is there like a specific limit in the U.S. at 6 months? If they expect you to live for only 6 months more, they'll send you to this? How do they decide when you'll go?
You decide. They don't.
Okay.
So if you are not feeling well, you know that your time is coming. You decide if you want to stay in the public hospital or in the cancer institution, or you can go to the Divina Providencia. But the nurse and the doctor explain to you everything about Divina Providencia, and at Divina Providencia they are going to treat you like with the best love. They mostly they can deny you a lot of things, and they use a lot of drugs for the pain, but you can decide if you want to go home. I mean, nobody is going to send you to a place that you don't want to go.
And how is death accepted in this culture? Or
sad? It's very sad. Right now, this country is having like a violence crisis. So we see the murders as a normal thing, as a daily thing.
And what
But we
injuries
also
are really common from the violence?
okay, that's later. And the rest of the deaths are because diseases or accidents. So if you know somebody who's in a gang, you know what you can expect. Or if you know somebody who's very sick, you know also what to expect. But if it is an accident, you were not expecting that. And so it depends of all the people. We have different kinds of funerals here, in my family, for example, we used to use like the place, like a very nice place to make the whole funeral and reception for the people with the body. With the body, you show the body. Some other village towns, they make like a walk with the dead on a car, not like a fancy car. It's more like a public car. It comes surrounded by flowers and music, and the people is going behind walking to get to the cemetery. And some other places they just decided to burn the body and do something with the ashes. I'm not so sure about that. I mean, it's very sad. Every time that you lost somebody, it's not like, oh, my neighbor, he's dead and my life keeps going. It depends of each person, I think.
Are cancer rates high here?
Cancer?
And what
Yes.
kinds?
Colon, lungs, liver, brain, bones, and osseous.
Us.
Yeah, where the spinal has like the damage.
Yeah.
Yeah, I don't know.
Okay.
How can I translate it?
I don't know. The,
Yeah, we
like,
call it here medulla ósea.
okay. Okay. I think that's about all.
Benjamin Bloom is a children's hospital in El Salvador that we visited, and it's the only pediatric hospital in Central America. There are 27 outpatient specialties and 300 inpatient beds. When we visited Benjamin Bloom, we saw a lot of extreme diagnoses that we do not see in the U.S. For instance, one of the highest rates of burns occurs in El Salvador due to the use of fireworks. We also attended a NICU in El Salvador where we saw things like hydrocephalus and extreme preterm birth.
Another hospital we visited while in El Salvador was Hospital Divina Providencia, the only palliative care hospital in El Salvador and in Central America. The hospital began as a shelter for people who were receiving cancer treatment that couldn't afford to stay in a hotel or other places, and its original aim was to help the poorest of the poor. It's located next to Senior Romero's home. And so that was really special because Romero would come visit the patients in the hospital. It has 128 patient beds, and people are referred by doctors when they're in their final stages of life.
Survival rates in lower-income countries such as El Salvador are much lower than higher-income countries such as the United States. One of the main reasons for this is that abandoning therapy is a common thing in lower-income countries such as El Salvador. Low socioeconomic status is directly correlated with access rates in El Salvador and lower-income countries. There's a vast underdeserved population remain vulnerable to the geographical gaps in the availability of cancer treatment, early detection, and palliative care services, according to the American Cancer Society. According to the American Cancer Society, perceptions of cancer vary with educational levels, social indicators, and access to early detection and treatment services. More than 70% of cancers in Latin America are diagnosed when the disease is incurable, and therefore too late. There are also higher rates of cervical cancer in lower-income countries such as El Salvador. The American Cancer Society also states that most governments in the region tend to focus on addressing health challenges related to infectious disease and infant mortality, largely ignoring the evolution of chronic diseases, including cancer, as a looming health threat that can and will bankrupt their public health systems. Chronic diseases that we saw in El Salvador included diabetes, hypertension, STIs, and lack of education, leading to higher incidences of chronic illnesses and congenital abnormalities. As stated previously, we saw many burn victim patients from firework usage. There's a lot of lack of educational resources associated with firework use. We also saw a lot of congenital anomalies from lack of education in the El Salvador community.
The Latino culture and the American culture view death as very different things, and they handle it very differently. In the Latino culture, death is very familial-centered, and decisions for the dying patient are made based on the family versus the patient itself. They're often very closed off, and they have a lack of communication. There's a study that found many patients have no desire to discuss their death. They didn't want to know the prognosis. They didn't want to talk about many of the aspects surrounding their death. Many of the patients are also in denial about their death. They didn't want to talk, and not only the patients, but also the family didn't want to talk about the death and the impending death that would occur. There's a lack of research on Latino cultural values regarding palliative care, some because there's not a whole lot of palliative care in Latino culture, and also just due to that lack of communication and sense of being closed off. Many of the studies surrounding Latino patients and hospice care were performed in the United States, where hospice care is very common here. They found that in hospice care in El Salvador, it was limited compared to the population. They had a very limited use of morphine there and other pain medications, and it was largely donor-funded versus the U.S., where the government funds hospice care. Patients in the Latino culture were less likely to use hospice. This was likely due to the misconceptions about hospice care, and why does this keep saving my file? Patients from the Latino culture are less likely to use hospice, and they're more likely to experience cancer pain, and the caregivers in the Latino culture were more likely to experience depression. The view of hospice and why it's used so little in the Latino culture is because they view hospice as a place for old, poor people, and they also view it as an emergency situation or a destination versus comfort care for up to months or even years. Children in the Latino culture are more likely to use hospice care than non-Latinos, which was a surprising fact. But the one downside to this is many pediatric patients left before the death occurred. Although Latinos are less likely to experience hospice care in the U.S., some of them do. But there are also downsides to a patient coming to the U.S. and receiving hospice care. They might receive the best care they could get in the U.S., but they would also be separated by their families by a large distance, and some families might not have the means to travel here. Some people are undocumented and uninsured, so they would not be able to have access to hospice care, or they would fear that their documentation might be discovered. There's also a language and cultural barrier. A translator is needed when healthcare workers can't successfully speak in Spanish. And there's also that cultural barrier because death is viewed very differently in the Latino culture versus the U.S. culture. Another reason is that Latinos can be concerned about being discriminated against in their palliative care. In conclusion, there are some obvious differences in culture surrounding Latino patients and U.S. patients surrounding palliative care and death. The death is viewed very similarly among the cultures, but following the death and the funeral is very different. There is a definite need for more research surrounding palliative care and cancer and how to reduce race, and there is a definite need for more researchers, being that the hospitals we visited were the only ones in Central America that specialized in their specialty.